Assalamualaikum warahmatullahi wabarakatuh and good morning to Dr. Said, lecturer of educational psychology, and my fellow classmates. Today we are going to learn about learners with exceptionalities. Okay. This is the outline of this chapter. We have 5 main topics consists of who are learners with exceptionalities, what is special education, what is response to intervention, what is inclusion, and what are effective strategies for students with disability in general education. My teammate and I are going to explain one by one. For the first one is the first main topic, which is who are the learners of exceptionalities. Okay. The definition, learners with exceptionalities is a student who have special educational needs in relation to societal or school norms, either higher or lower, that additional services are needed to meet the individual needs. So there are three types of students, which are children with delayed development in physical, communication, cognitive, social, emotional skills or abilities. Gifted and talented children. Last one is children at risk. Those who are at risk of having problems in terms of physical, communication, cognitive and emotion due to various factors including lack of exposure, being neglected or abused. Disability means functional limitation a person has that interferes with the person's physical or cognitive disabilities. For handicap, it means condition that imposed on a person with disabilities by society, the physical environment, or the person's attitude. Next, people first language. It is important to ensure that our language and choice of vocabulary in referring to people with disabilities convey the appropriate message of respect. And according to Smith, there are two basic principles to keep in mind. First, to put the people first. Second, avoid making the person equal the disability. So, how we are going to use the people first language correctly? Example, instead of you saying autistic children, we should refer them as children with autism. Or, instead of saying dyslexic children, we should say children with dyslexia. Okay. People first language is important to be practiced on because it shows the respect for the people with disability. Next is types of exceptionalities and the numbers of students served. As you can see from this pie chart, in 2011, specific learning disability took the most percentage in all of them. For the first chart, it is from the National Center of Education Outcomes from 2011 and 2017. It is a chart on students with disability. For chart in Malaysia, unfortunately, I could not find the chart for student only. So it shows only person with disability. And as you can see, learning disability has the most percentage. Okay. Next is the students with mental retardation. Mental retardation is a disability characterized by significant limitation both in intellectual functioning and in adaptive behavior as expressed in conceptual, social, and practical adaptive skills before the age of 18. And the causes for mental retardation, there are 5. First one is genetic. And as you all know, gene mutation can cause genetic disorder. The disease that can cause from gene mutation is first autosomal recessive. It can cause disease like cystic fibrosis or sickle cell anemia. For autosomal dominant, The diseases are Huntington disease or neurofibromatosis. An X-linked disorder can cause color blindness or muscular dystrophy. Second is the chromosome abnormality. It occurs during meiosis or during meiosis and mitosis. Okay. The first one is disjunction. Disjunction on chromosome can cause Down syndrome or Klinefelter syndrome. Translocation can cause cancer, Down syndrome, or SS-Mel syndrome. And deletion of chromosome can cause Cry-Duchet syndrome, which is a cry like a cat. The baby will cry like a cat. Third is teratogen. Teratogen is an agent or factor that causes malformation to the developing fetus. Example of teratogen is alcohol, drugs, nicotine, radiation, mercury leaks, or pesticide. It can cause fetus death, malformation, growth, and functioning problems. The fourth one is the infection. Infection can happen from the mother itself or from the outside agents. So infection agents are like syphilis, toxoplasmosis, varicella, rubella, or herpes. And from the mother itself, from the mother disease, the diseases like the diabetes mellitus, hypertension, lupus, anemia, fetal hemolytic disease. Okay, the last one for the cause of mental retardation is the environment itself. Hygienic and safe environment during pregnancy can ensure healthy, nourished, and happy mother and baby. However, if the family is an abusive family, the baby might be danger because anything can happen in abusive situation. For intelligence quotient or IQ, it is an intelligence test score that should be near 100 for people of average language. However, for mental retardation, there are degrees of severity for them from mild to profound. Okay. For each classification of intellectual disability, they have their own level of support needed. So for intermittent, supports are provided as needed. Individual may need episodic or short-term support during lifespan transition. Intermittent support may be low or high intensity when provided. For limited intellectual disability, supports are intense and relatively consistent over time. They are time-limited but not intermittent, and it requires fewer staff members and costs less than more intense supports. For extensive intellectual disability, supports are characterized by regular involvement, for example, daily, in at least some setting, for home or work, and are not time-limited. Last one is the pervasive intellectual disability. Supports are constant, very intense, and are provided across settings. They may be a life-sustaining nature. These supports typically involve staff members and intrusiveness than the other supports category. So what can the teachers do? What can we do to help the student with mental retardation? First, help them cope with the demands of school. We the teacher should help them in attending learning tasks, organizing work, following direction, managing time, and asking questions. Second one, help them developing interpersonal relationship. So, help students learn how to work cooperatively with others or respond to social cues in environment. The third one is developing language skills. Help students so that they can understand direction, communicating needs like want to go to the toilet, expressing ideas, listening attentively, and using appropriate voice modulation and inflection. The fourth one is the social emotional development. Students can seek out social participation and interaction to decrease social withdrawal, and also to be motivated in working, to decrease the work avoidance or tardiness. The fifth one, personal care. So students practice appropriate personal hygiene, dressing independently, taking care of personal property, and moving successfully from one location to another. For students with learning disabilities means intellectual disabilities characterized by below average intelligence or mental ability and lack of skill necessary for day-to-day living. The IQ below 70 or 75. Characteristic for norm characteristic of students with learning disability is normal intelligence or even giftedness. So giftedness also in learning disability. Discrepancy between intelligence and performance. Discrepancy means inconsistent. So inconsistent between intelligence and performance. Next is delay in achievement. So students have um, delay in achievement. Next is attention deficit or height distractibility, hyperactivity or impulsiveness, poor motor coordination and spatial relation ability, difficulty in solving problems. Difficulty in solving problems mean like really easy problems. Perceptual anomalies such as reversing letters, words or numbers, difficulty with self-motivated, self-regulated activities, over-reliance on teachers and peers for assignments, specific disorder of memory, thinking, or language, immature social skills, and disorganized approach to learning. So example of learning disabilities are dyslexia, dysgraphia, and dyscalculia. Dyslexia meaning learning disorder that involve difficulty reading due to problem identifying speech sound and learning how they relate to letters and words. Example for this is confused between letters B and D. Next is the dysgraphia. It is inability to write coherently. The handwriting are unclear or irregular or inconsistent. And they have unusual wrist body position while writing. And dyscalculia is a difficulty in learning or comprehending arithmetic, which is mathematics. Example for this is difficulty in reading analog clock. So they can't read analog clock. And they're usually confused about number 6 or 9. For students with attention deficit hyperactivity disorder or ADHD, ADHD is a difficulty in maintaining attention because of a limited ability to concentrate or include impulsive action and hyperactive behavior. So there are 3 types of ADHD. The first one is inattentive, or which is means significant difficulty in sustaining attention to tasks. So the student cannot do one thing for a long time. They will get bored. For hyperactivity or impulsivity, it means excessive motor activity and difficulties with remaining still, and tends to act in response to immediate stimuli without consideration of the risks and consequences. For example, they will run around on a field barefoot, not afraid of getting injured at all. And the third one is combination. It is a combination between inattentive and hyperactivity. So, for children with ADHD, some of them do not qualify for special education. unless they have some other disability that is defined by the law. So ADHD but also have dyscalculia, so they can join the special education. But if it's only ADHD, the student cannot join the special education. Okay. And the treatment for ADHD, for people with ADHD, is first medication and the second one is therapy. But for medication, they are not really recommended to children with ADHD unless they really needed it, because some medication has side effects such as sleeping problems, headache, and blind appetite. Okay. And so what can the teachers do for students with ADHD? So first, we can make sure the student understand all classroom rules and procedures. The second one is consider carefully the seating arrangement of students with ADHD to prevent distraction and to keep the student in proximity to the teacher. The third one is adhere to the principles of effective classroom management. The fourth one is understand that certain behavior, although not desirable, are not meant to be compliant. Students might not be able to control their behavior. And to allow students who are hyperactive to have many opportunities to be active. Next is the refrain from implementing a behavior management system that is predicated mostly on the use of punishment or threats. So next is group student ADHD wisely, taking into consideration of the purpose of the group and other students who will be the members of the group. Teach students to manage their own behavior, including self-monitoring, self-evaluation, self-reinforcement, and self-instruction, and maintain ongoing communication with the students home by using daily report cards or other instruments to convey information. Last one, collaborate with special education personnel to develop behavioral and instructional plans for dealing with attention problems. Okay. For students with speech or language impairments. First one, I'm going to explain about students with speech disorder. Okay. It is most common articulation are such as omission, distortion, or substitution of sounds. An example, pronouncing R's, saying sorry instead of sorry. And misarticulated words are common and developmentally normal for many children in kindergarten. It can be diagnosed and treated by speech pathologists or therapists. However, the lasting damage is more often psychological than phonological because students with speech disorder usually subjected to teasing and social rejection. So what can the teachers do? First, we can be patient with students who are stuttering or having trouble producing words. Second, do not finish a student's sentence or allow others to do so. Third, avoid putting students who have speech problems into high-pressure situations that require quick verbal responses. And the last one, refrain from correcting student articulation in class. For students with language impairment, it means impairment of the ability to understand language or to express ideas in one native language. Physical problems or hearing or speech impairment might be the reason why there are difficulties in understanding language or communicating. Lack of experience with standard English is not receptive or expressive language disorder. This is because the students speak either a language other than English or a dialect of English. So, and preschool programs that are rich in verbal experience and direct instruction in fundamental of standard English have been found effective in overcoming language problems that are characteristic of children from disadvantaged homes. So students with speech or language problems usually can get better with speech therapy or a really good preschool program. Next is student with emotional and behavioral disorder. Emotional and behavioral disorder means exceptionalities characterized by problems with learning, interpersonal relationship, and control of feelings and behavior. So characteristic for the student with emotional and behavioral disorder are an inability to learn that cannot be explained by intellectual, sensory, or health factors. And next is the inability to build or maintain satisfactory interpersonal relationship with peers and teachers. Next, inappropriate types of behavior or feelings under normal circumstances. And next, general pervasive mood of unhappiness or depression. Last one is a tendency to develop physical symptoms, pains or fear associated with personal or school problems. Causes for emotional and behavioral disorder are first, neurological functioning, second, psychological processes, third is history of maladaptation, fourth, self-concept, five, lack of social acceptance, and last one, family dysfunction and maltreatment. So, changes in family structure, like parents getting divorced or someone in the family died, might leave a child depressed, angry, or insecure. And the characteristic for students with emotional and behavioral disorder are poor academic achievement, poor interpersonal relationship, poor self-esteem. So there are four general categories that by Quay and Wary for students with emotional and behavioral disorder. First one is conduct disorder. Next is the anxiety withdrawal, and third is the immaturity. These third categories means social, emotional, and behavioral disorders that indicated in individuals who, for example, are chronically disobedient or destructive. The fourth one is socialized aggressive disorder. It relates to frequent aggressive against each other, seems to be tied more to pure to poor home condition that model or reward aggressive behavior. Therefore, it might be addictive. So it means socialized or aggressive disorder. It means this aggression comes from his surrounding. So like the poor home condition. Okay. For student exhibiting aggressive behavior, student with conduct disorder and socialized aggressive behavior might frequently fight, steal, destroy property, and refuse to obey teachers. So there tends to be disliked by peers, teachers, and sometimes their own parents. They do not respond to punishment or threats, so they might be skilled at avoiding punishment. So the children with that exhibit aggressive behavior, even though we punish them, they do not care about the punishment. And aggressive children often develop serious emotional problems later in life. They will have difficulty holding jobs and may be involved will be involved in criminal behavior. So effective approaches for aggressive behavior is behavior management strategies. So we can send these children to participate in a behavior management therapy. Okay. And for students with withdrawal and immature behavior, so children who are withdrawn, immature or low in self-esteem or depressed. So they typically have few friends or play with children much younger than themselves. And they often have elaborate fantasies or daydreams and either very poor or grandiose self-image. So they really like to fantasize something, and even though it is a small thing, they will make it big. Okay, and some of the children might be overly anxious about their health and feel genuinely ill when under stress. So these children will, if they are too stressed, they will fall ill. And some exhibit social phobia by refusing to attend or by running away from school, so they don't like schools. And rather they appear quite normal like aggressive kids, these children tend to appear odd or awkward at all times. Okay, that's all from me, and I'm going to pass this presentation to my friends. Thank you.
Assalamualaikum. My name is Nur Atika, and I'm going to continue the presentation with students with autism spectrum disorder. The US Department of Education defined autism as disability that significantly affects social interaction and verbal and nonverbal communication. So for autism, there is no cure, and appropriate interventions are depend on child level of functioning. And children with ASD, they're better working in small groups or being assigned a peer partner to help with social and academic problems. Next is students with sensory, physical, and health impairments. Sensory impairments are problems with the ability to see, to hear, and to receive information through the body senses, while physical disorder including cerebral palsy, spina bifida, spinal cord injury, and for health disorders are including AIDS, diabetes, cystic fibrosis, and including chemical addiction, child abuse, and attempted suicide. Next is student with visual disabilities. So visual loss is considered as disability only if it is not correctable, while visual problems are correctable by glasses or other types of corrective lenses such as contact lens. So vision loss and visual problems are two different things. Visual disability known or as we known as visual impairments included blindness and color blindness. So this picture over here is called as Snellen chart, where we use it to check our eyes vision. A person defined as legally blind is one whose vision is judged to be 20/200. As we can see at the chart over here, it is the highest one. Or worse, in the better eye, even with correction, or whose field of vision is significantly narrowed than a person of normal vision. Person with partial sight, which is one's visual capability is limited, are those whose vision is between 20/70 and 20/200 in the better eye with correction. So possible signs of visual loss if the children is often tilts head, rub eyes often, eyes are red, inflamed, crusty or water excessively, has difficulty reading small print or cannot discriminate letters, complain of dizziness or headaches after reading assignment. And this is fact about visual disabilities. So individuals who are legally blind, they are not actually have no sight at all, which is mean they actually have sight but very, very limited. And more than 80% of students who are legally blind can read large or regular print books. and many students with vision loss can be taught in class by having a modification in usual teaching materials. Next is students with hearing impairments. So hearing problems is a problems in hearing, either permanently or fluctuating, that affects one's learning or school performances. And hearing loss is loss of ability to hear more than 30 decibel in the better ear. And hearing loss can be categorized according to the location of the damage, level of severity, unilateral or bilateral loss of ability. So unilateral is hearing loss in one ear, while bilateral loss of ability is hearing loss in both ears. So the signs for student who's having hearing impairments, they breathing through the mouth, pulling ears, have abnormal or low quality of vocalization, fail to respond to loud sounds or broad sounds, surprised when touched when the people have or are interacting with them, speak but does not produce sounds like they moving their lips, but we can hear inaudible sounds from them. And have difficulties in differentiating the similar sounds. So there are two causes for hearing impairment. First is congenital, which present at birth or right after birth, including genetic abnormality or complication during pregnancy or labor process. And the second one is acquired, which is at any point of life, including infections, medication side effects, injury to head or an ear, environmental exposure to loud sounds for a long period of time. Next is students who are gifted and talented. According to National Association for Gifted Children, students with gift and talents perform or have the capability to perform at higher levels compared to others of the same age, experience, and environment in one or more domains. They require modifications to their educational experiences to learn and realize their potential. Giftedness once defined almost entirely in terms of superior IQ or outstanding in mathematics or chess, but now accompany students with superior abilities in a wide range of activities, including art. Which means now they define superior IQ, not only based on education, but also including like personal skills like art. And most students who are categorized have IQs above 130, and approximately 3 to 5% of students are considered gifted. So characteristic for gifted and talented students, they have strong motivation, they academically superior, learn to read early, and do excellent work in most school areas. They're rapid learner, they have excellent memory, unusually large vocabulary and complex sentence structure for each, have advanced comprehension of word nuances, metaphors, and abstract ideas, and they enjoy solving problems, especially with numbers and puzzles. So this is the education for gifted students. The first one is acceleration program, which is a rapid promotion through advanced studies for students who are gifted or talented. There is a few acceleration programs that we know. One of them are grade skipping, early entrance to kindergarten or college, and subject-based acceleration. For example, when the 5th grade student takes a middle school math course. The second one is enrichment program, in which assignments or activities are designed to broaden or deepen the knowledge of students who master classroom lessons quickly. There is 3 activities included in this program. The first one is general exploratory activities, which is a project that allows students to find out topics on their own. Second is group training activities, which is games and simulations to promote creativity and problem-solving skills. The third one is individual and small group investigation of real problems, where they're writing books or newspaper and conducting geological investigation. Next, I'm going to present about special education. So, what is special education? Special education is a program that addresses the needs of students with mental, emotional, or physical disabilities with or without general education classroom program. Public Law 94142. In mid-1960s, many handicapped students received no special services at all, and those who did, they usually attended spirit schools or institutions for people with mental retardation, emotional disturbance, or vision or hearing loss. So as a result, Congress passed Public Law 94142, which is a federal law enacted in 1975 requiring provision of special education services to eligible students. Next is IDEA. Public Law 101478 is a federal law enacted in 1990 that changed the name of Public Law 94142, which we call Special Education Law, into Individuals with Disabilities Education Act, IDEA, and broadened services to adults with disabilities. Next is requirements of IDEA. The first one is least restrictive environment. A provision in IDEA that requires students with disabilities to be educated alongside peers who have no disabilities to the maximum extent appropriate. Second is mainstreaming or inclusion. The temporary instructional and social integration of eligible children who having exceptionalities with peers who do not have exceptionalities, which is mean that general education classroom teachers can have students with mild disabilities such as students who have learning disabilities, mild mental retardation, or speech problem in their class who might leave class for special instruction part of the day. And the last one is Individualized Education Program, or we call as IEP. IEP is a program tailored to the need of a learner with exceptionalities by describe students' problems and provide specific course of action to address these problems. So individuals involved in IEP including teachers, therapists, psychologists, parents, and students. So IEP comprises students' performance level, plan for the student, both academic and non-academic component, accomplishable goal, the ones that the student can achieve, measurable objective for each goal, objective procedures, assessment to evaluate students' performances, and services needed by the student. Next is an array of special education services. This is an arrangement of special education services for students with disabilities that being provided by schools. And these lists are going from the least to most restrictive. The first one is direct or indirect consultation and support for general education teacher. Second, special education up to 1 hour per day. Third, special education 1 to 3 hours per day for resource program. Fourth, special education more than 3 hours per day for self-contained special education. Fifth, special day school. Sixth, special residential school. Seven, home or hospital. And this is the other services available for students with disability, and this going from least to less restrictive. The first one is general education classroom placement. Next, collaboration with consulting teachers and other profession. Resource room placement. Special education class placement with part-time inclusion. Self-contained space, special education. And the last one is related service. So this is all from me. I'm going to pass the presentation to my next group member. Thank you.
Assalamualaikum warahmatullahi wabarakatuh, and good day to all of you. My name is Nur Hazmah binti Hamsi, and I will proceed our group's presentation with my part, and that will be the response to intervention, okay, the RTI. RTI is divided into three different tiers, okay, the prevention, the immediate intervention, and the intensive intervention. Okay, so here's the definition of RTI. Okay. So RTI is like a process that refers to how well students respond to research-based instruction, or in other words, the idea of RTI is simply to help students when they begin to struggle. Okay, so all right, let's start with tier one, okay, the primary instruction. So in tier one, this actually involves like all students within the school. So it means like for this special education class and the general education class. Okay, for example, in a typical classroom, the teacher, they will act like the first line of defense, and they will do the screening on the students, they'll do the progress monitoring. Okay, so The teachers, they should measure the students' progress by alternative approaches besides tests. Okay, so maybe they can do like some simple activities just to observe whether their student can actually understand on what they're learning at the current time. Okay, now we're moving to for tier 2, okay, the secondary intervention. So this takes place for students that have not been able to proceed or to have like good progress in tier 1. So they will be referred to tier 2. The students are identified as in need of intervention and needed to learn in a smaller group, okay, compared to when they were in the regular classroom or the general education classroom. Like, for example, the teacher would teach basic mathematical concepts if the student seems like having like struggling with even simple mathematical concepts. And however, this doesn't mean that tier 1 would be ignored or abandoned, okay, because it's supposed to like act like the supplement tier for tier 1, okay, like the additional or support for tier 1. And okay, of course, in this year, since the students will be learning in a smaller group, then there will be extra monitoring, more attention for them, so they can have like extra understanding, okay, and maybe extra time for the teacher to make sure that every single one of them can get that extra attention and guidance or instructions, okay. Tier 3, okay, so in this tier the students would have like serious intervention. Okay, this is for the students that actually still struggle, okay, still struggling, even though they have been referred to tier 2, they're still not improving, so that's why they're being um, referred to tier 3. Okay, so there will be the need to increase time and frequency of instructions. So this means the school needs to find the suitable time for the students to get the extra help in any way possible. Okay, so the student need to their own like individualized learning goals, which means the goals are specifically just for them. Okay, for example, if they have problem to fluently talk, then they can see like speech therapist. For the student with ADHD, okay, attention deficit hyperactivity disorder, okay, so they might just see the behavioral therapies, and the students for autism spectrum disorder, they can see like the cognitive behavioral therapies. Okay, so in this year the group will be smaller, and actually for tier 2 and tier 3 they can just learn like one-to-one with the teacher for the lesson, okay. Okay, now we're moving to mainstreaming. I will explain about mainstreaming. Mainstreaming is used to refer to the selective placement as special education student in one or more regular education classroom. Okay, it means like even though they're the special student with special need, that doesn't mean that they have to spend like for the whole school session for the whole day in a special education classroom. Instead, they can actually learn in regular education classroom. Okay, the proponents, the supporter of mainstreaming generally assume that the student must earn their opportunity to be placed in a regular classroom, okay, with um, like any other students by demonstrating an ability to keep up with the work assigned by the regular classroom teacher. They need to show like they actually capable of being in the same classroom as any other student. So this concept is actually closely linked to traditional forms of special education services delivery. Special education students can be mainstreamed into a regular education classroom for part of the school day. For example, they can spend English period in regular education classroom, but then when during math period, they can spend um, the time to learn in the special education classroom instead. Okay, mainstreaming is actually something that customizable and often relies on the judgment of the special education teacher and the regular education teacher. So because these two individuals will be the one who's like keep in constant communication to clearly evaluate the students' progress. When used correctly, actually mainstreaming allows the special education student to take advantage of all the resources available to them, because they have been learning in the regular education classroom, and also they've been learning in special education classroom. So they can get like that extra resources for them to keep improving. Okay. So we're moving to the inclusion. Okay. So inclusion is actually a commitment to educate each child to the maximum extent appropriate to what they need in the classroom in the school. Okay, so it involves bringing support services to the child rather than the child going to the services. Okay, so inclusion is actually the educational practice of educating children with disabilities in the same classroom as the students without disabilities, like placing them in the same classroom. Okay, so inclusion is actually divided into two, the partial inclusion and the full inclusion. Okay, so here it is. Partial inclusion is actually like having a special education teacher enter the classroom to provide instruction and support to the children. So they will bring like materials into the classroom that might just help the student to understand better. Okay, the teacher might also work with the children on math during math period, like solving the math questions together, so that maybe the special education student would see like in detail how they can properly do or solve the question. So for the full inclusion, a special education teacher would be placed in the classroom as the full partner for the regular or general education teacher. That would be like a partner for the whole class, for the whole session, so that they can be there. They are like prepared if the student needs them like anytime. So here is the research on inclusion. Okay, so there are two groups of them, like the mild academic disabilities. Okay, so one group they learn in like the general education classroom and the other in the special education classroom. Okay, so they have like accommodation, they have like the instruction or guide they need in the regular classroom, and those who learns in this regular classroom show they learn much better compared to those who learn in the special education classroom. Okay, I think that is all from me. Thank you so much for listening. Thank you.
Hello, Assalamualaikum. I am Ani Zulfa. I will present effective strategies for students with disabilities in general education. There are 8 teaching strategies for students with disabilities in general education. The first teaching strategies is adapting instruction. Change the format of written assignment without change the actual task. The reason to change the format is the question is too long, the spacing too close, maybe the question itself confusing, and the example that being used are absent or misleading. The direction for a task must be simplified. Teacher also need to teach the word that easily found in direction, such as circle, fill in the blank, underline. Next is content adaptation. Content adaptation is for students who cannot process too much new information or students who are lacks prerequisite skills. Way to adapt the amount of content is to isolate each concept and require mastery of each concept before teaching the next concept. For students who lacks essential prerequisites is explaining the vocabulary or concept before teaching the lesson. Next is modes in communication. For students who cannot learn through reading, demonstration, film strip, film, television program, audio recording or debate may be the possible ways today for they to learn. For student who has writing skills problems, ask the student to tell about the concept in private conversation or record the student response or ask the student to draw the picture or diagram. The last one, adapting instruction, is extending the time. This is for slow workers or students who anxious in testing circumstances. The next teaching strategies is teaching learning strategies and metacognitive awareness. Many students do poorly in school because they have failed to learn how to learn. So, the teacher must teach how to take note, make summarization, and the effective memorization methods. The third teaching strategies is prevention and early intervention. Many students could have succeeded in school in the first place if they had effective prevention and early intervention programs. So the never streaming is avoid mainstreaming or special education dilemma by focusing attention on intensive early intervention to remove the need for special education. Next is tutoring and small group intervention for struggling readers. Preventing reading failure and helping children who are already behind in reading is very essential. One-to-one and small group tutoring improve reading performance of struggling readers. Next is computer. Computer facilitates individualized instruction, provide immediate corrective feedback, promote active learning, maintain attention of children who are easily distractible, enhance motivation, exhibit passion, create an atmosphere students feel they can control. And last, provide instruction that is positive, reinforcing, non-threatening, exploratory, and challenging. The next teaching strategies that can be used is buddy system and peer tutoring. This provides students with disabilities with assistance from classmates without disabilities. Buddy assistant can help by taking notes, ensuring correct materials are being used, ensuring correct page is being read, and helping with classroom procedure. Peer tutoring Peer tutor can help by helping with difficult concept or tasks and reviewing material as needed. The next is special education teams. Classroom teacher will works with special educators in order to ensure the successful integration in regular education class. Plan and evaluate the work. Next, efficiently coordinate the services. The last teaching strategies is social integration of students with disabilities. Teachers should make sure that students with disabilities are integrated socially and instructionally in the classroom. Teachers should model positive attitude of acceptance and respect. Teachers should utilize cooperative learning and small flexible group work, which allows students to interact with each other. Teachers also should teach necessary social skills. Teachers also should utilize the effective classroom management. That's all from me. Thank you for listening.